discussion started at least. Wanted to welcome everyone. Thank you all for being here to our Support After Stroke conversation. We do these discussions once a month on the second Tuesday of the month between 3:30 and 4:30 in the afternoon. We'll have open time for discussion after Kelly puts on her presentation. She has a slide presentation to go through. We will also post this afterwards on our website for stroke support, and I'll forward that information to everyone who was invited to the program. We also have a Facebook page as well that has a lot of this information. It's under the Halifax Stroke Support Group, if you look that up. So today, we are lucky enough to have Kelly here, who's going to discuss with us Caregiver Support Community Resources, which I think is something that a lot of people may not necessarily get a chance to hear about. So I'm super excited that Kelly was able to have this discussion with us. She comes to us from our sister facility, our sister. I would say we work concurrently together with the rehab department over in Brooks, and she's one of their wonderful case managers.
Thank you so much, Samantha, for letting me have the opportunity to be here with you and share our knowledge about resources for patients that are recovering from a stroke and their loved ones that are at home with them and helping them recover and get their life back. So at this point, I'll go ahead and share my presentation.
Fabulous.
Let's see. Oh, there it is down there. Let's see if I can pull this off. You guys are my first Zoom. So, and here we are. I think I've got it. Share. How's that?
Perfect.
All right, and then we'll do slideshow. Let's see. Trying to remember.
Is it the top up there? It's above insert.
Up there it is. Start. There we go. All right, you guys, are we ready? Here we are. So coming to you from the hospital here at Halifax Brooks Center for Inpatient Rehab. So if you hear some hospital noises, that is why, and we apologize in advance, but appreciate your time. And today we are going to talk about community resources for stroke survivors and their caregivers. And I'm gearing this conversation today towards folks who may not have had the opportunity to go into a rehab center. Just because you have a stroke doesn't always mean that you have opportunities to take advantage of all the different resources and services available in our community. So I'm going to gear this presentation towards folks that might have been in a rehab unit and just need a refresher, or maybe you were too high functioning to get into rehab, or maybe you didn't have as many deficits that you needed to go inpatient, but you still need to know about the services available in the community and how to continue to recover and get your life back. So we'll talk about the services offered through home health care, outpatient rehab, and also some services available in the community to help those who may not have insurance or might be underinsured as well. So one item or one thing that folks most usually end up needing after having a stroke, if you are having deficits in maybe your balance or with heavy paresis, which means having paralysis on one side of your body, you might need to have items like a wheelchair or a walker. There are a lot of things that you can add to your home in order to improve your balance and keep you from falling. One thing that we say quite often in rehab is that after a stroke, gravity is not our friend, and we need to prepare for our movements to make sure that we are moving around our home safely and moving around the community safely. So if you were in the hospital and left without getting anything, having your family physician or a doctor write for a wheelchair or a walker with the discretion of a therapist, that would definitely be a good idea if you're concerned about falling, if you feel that you lose your balance at times. Possibly, maybe some items are recommended for you when you first had your stroke, but you didn't have the ability to get them. And so there are some options in our community. We've learned from fellow networks that there's a wonderful program called Assisted Living Made Simple. I believe they're down in New Smyrna Beach, and they have a lot of free and low-cost medical equipment. Their phone number is listed on this PowerPoint. We've found, luckily, in this realm of new normal, that the medical equipment that you find online is a lot cheaper now than it used to be a few years ago. Things like wheelchair ramps and used equipment can be found on the internet for a lot cheaper than it used to be maybe 4 or 5 years ago. So maybe in the past something might have been too expensive. Look again, because it might have the price may have gone down. But these types of things are really helpful, especially with bathing. If you are concerned about showering by yourself, maybe having a shower chair in your shower or adding some grab bars can also make it more safe so that you don't end up slipping in the shower and causing an additional fracture or an injury that could re-hospitalize you. But most importantly, if you have been in a situation where your therapist or your doctor is recommending some equipment, go ahead and use it for the time being. They may have you on a walker for a period of time, but that doesn't mean that that will be forever. Stroke recovery takes a while. It's a marathon. It's not a sprint. And so having that walker for a period of time while you're working on your balance can really help so that when it is time to be able to progress off the walker with your therapist, you're stronger in that way and you're less likely to have fallen in the interim. So that is the medical equipment. So after leaving the hospital, after you had a stroke, possibly you may have been set up with services, or maybe you went home without any services. If you do have insurance, home health care can be a wonderful way for you to continue to have medical oversight, have nurses come check on you at home without having to leave your home. And you do have to be homebound, certified homebound, in order to have home health. But it's a wonderful conduit from the hospital to your primary care doctor and then to your home. So God forbid if you were to go home from the hospital and start not feeling well, having new symptoms, new signs of weakness, you could call your home health nurse and they could reach out to your physician and get some real-time advice about how to progress with whatever is going on with you at home. We also recommend home health care after discharge from the hospital in case you may have trip hazards or some changes that could be made to your home in order to make it safer. Most therapy is covered by regular commercial insurance and also Medicare. There may be a small out-of-pocket, and sometimes there's a limited number of visits authorized per week, but the home health services offered through insurance are really good to have if you do have some health insurance to cover that. You can get orders for those services through your primary care doctor, and they should have a list of also programs that are in network with your insurance. One important thing to remember, though, is that the home health care provided through an insurance plan does not replace a caregiver. So if you know for certain that you need help using the restroom, or you need help being able to prepare a meal, you probably need a little bit more than what the intermittent skilled home health services are that are provided through insurance, because they are intermittent. They will come a few times a week, but their focus is going to be on teaching you about your stroke recovery and exercises and progressing your function, and not as much helping around the house, unfortunately. Another type of rehab you can have after discharge from the hospital or after having a stroke is called outpatient rehab. And this involves traveling to local outpatient clinics, usually 2 or 3 times a week. Outpatient rehab is a much more aggressive form of therapy because those therapists are able to have the exercise machines and the mat tables and really put you through the paces in a more aggressive way that is available through home health care. And outpatient is also a really nice transition after home health care. Maybe you're feeling you've met your goals in your house and you want something more aggressive. So there's lots of outpatient centers in the Volusia County area. Several are a part of the Halifax-Brooks joint venture. Therapy in outpatient is usually 2 or 3 times per week, and that is per discipline. So you could have physical therapy, speech therapy, and occupational therapy 2 or 3 times a week for your stroke rehab at the clinic. Each session usually lasts about an hour. And there usually is a copay for most outpatient services through commercial insurance and also with Medicare. However, Halifax Brooks is a nonprofit company, so we do have options available. There may be scholarships available for patients who either live in the Volusia County area or qualify financially for financial assistance. So if you do not have insurance, or maybe you're waiting for your disability to go through, then contact the Halifax Brooks Rehab Clinic. They may have an option for you that can keep you exercising and keep you in therapy while you're waiting for your benefits to go through. Okay, let's see what's next. There we go. All right, private pay caregivers. So let's say that you live by yourself or your family works during the day and you're concerned about being alone at home. There is the option, if you've been saving for a rainy day, to hire an attendant, hire a nurse's aide who can sit with you or assist you with bathing and dressing and showering, also light housework and homemaking services. There are also caregivers who can provide transportation, and they are a for cost service. This is not something that's covered by commercial medical insurance or Medicare, but if you have been saving for a rainy day, and this could very well keep you from re-hospitalizing or keep you from falling at home, and also basically reduce the anxiety that you can have by just with transitioning out of the hospital. It is a really scary time these days with everything happening with the pandemic. And if hiring a caregiver for a week or two just to help you transition home will take that weight off your shoulders, it is worth its weight in gold. So average cost of caregivers range between $16 to $25 an hour. And if you would like some information about the agencies available in town or recommendations, we're happy to help with that. If you did happen to purchase a long-term care policy, because there are a few folks out there that signed up for those. They do have a benefit for the private caregivers, but there usually is a period of time where you need to pay out of pocket. Sometimes it's a 60-day window, sometimes it's a 90-day window based on what you signed up for. But if you have that insurance policy and you know you need some help, give them a call and see. Most of the agencies that you work with will help you fill out the paperwork. So that can help get the ball moving if the paperwork can be intimidating. Okay. All right. Assisted living facilities. These are another option if you have a little bit of savings in the bank, or maybe you're putting some money away for this type of arrangement. There are some really lovely assisted living facilities in Volusia County, and these places are for folks who are either wanting to just have a respite time, like a month or so, or if they want to have a permanent transition. And Volusia County and the surrounding areas, they have everything from a beautiful 5-star resort, fine dining, and not a care in the world, permanent vacation type of assisted living, all the way down to a home that has maybe 6 rooms and 6 residents. And the patients are more in a regular communal type of situation where there's a kitchen and the caregivers are always there. The residents don't get lost in the shuffle, and there's always someone there to help. And then there's everything in between. So if you're interested in learning more about assisted living, you can contact our friends over at Newport Senior Link. They are a free referral service for agents or for patients in the community who would like to learn about assisted living and see if there's a way that you can match up your finances to what's available in town. And then there's also Assisted Living Made Simple, and their number is listed as well. Because even though the prices listed here are a little bit high, there have been some of the smaller homes that can be a little bit cheaper and not as costly. So it's always a good idea to ask and get the word out there to see if there might be a good match for you to provide the care that you need. In order to live in assisted living, a person needs to be able to transfer, which transfer means to get from like a bed to a wheelchair. They need to be a one-person assist. So if your loved one requires a total assist or maybe needs a Hoyer lift to transfer, assisted living might not be the right time right now, but maybe down the road. So there's assisted living. Home modification. So let's say we want to stay in our house, but we need to tweak things a little bit. A lot of times with stroke patients, if you are suffering from the hemiparesis or the weakness on one side of your body, it may help you from falling if you install grab bars on your strong side. Now, suction cup grab bars might seem like a really good idea if you don't want to put holes in your walls, but trust us, it is not. They will fail the minute you really, really need them, and you'll end up on the floor with the grab bar. So we want you to have them installed into the walls. There's lots of good options available now these days where the handyman can use extra reinforced screws to really make them strong. Another option also, if you're using a wheelchair at the house, it may be a good idea to purchase a ramp because popping a wheelchair up over a step, that can get old really fast. And sometimes it could end up causing back problems for the caregiver if it's something that they're doing on a regular basis. So look into aluminum ramps. They can be purchased at local hardware stores, also Amazon and Walmart.com. We've noticed the prices going down dramatically recently, and they have these types of ramps that you are able to just put them down. They're temporary, and they can be like a 4-foot ramp for a 4-inch step. And they can be put down at your front door and moved to the back door if you want to use the back door. Another option for home modifications is moving your frequently used items to lower shelves in order to risk stepping up and falling if you're having one side weakness, hemiparesis. Watch out for throw rugs. Watch out for bathroom rugs and small animals. If you're transitioning home after a stroke, maybe if you have small animals, it might be good to have your family keep them in a separate room when you're walking around, just to make sure that we're not going to trip. Because it's not their fault. They don't know, but they probably missed you if you were in the hospital with a stroke. But we don't want anyone to step on the furry babies, and we don't want any of you to fall. So think about how to make your home a bit safer with removing rugs and throw rugs and little runners and such, and also keeping an eye out for small animals. All right, let's see what we have next. So medications. So most of the time after having a stroke, you are prescribed certain medications, usually something to try to prevent further strokes, right? Because if you have had a stroke, that means that you're at risk of having another one. So when you're getting out of the hospital, check with your prescription drug plan to find out if the medication you've been prescribed is covered. There is an app now called GoodRx you could get on your phone, and we use it in the hospital all the time. You can print out a coupon in real time for your medications and bring them right to the pharmacy. A lot of times the copay is reduced to maybe $4, maybe $10 for medications that might have cost a few $100s. If your medication's not covered by your drug plan, talk to your pharmacist about a different drug plan, because some of the Medicare programs don't cover everything. And if your doctor is confident that you're going to be on a certain medication for a long period of time, you want to try to make it worth your while so you're not paying too much. If you don't have insurance, stores like Walmart, Target, and Publix, they have a list of low-cost medications. So you can find those on the internet and print them off and see if your medications happen to be on those lists. But always, always make sure that you're taking your medication as it's prescribed by your doctor to prevent further strokes and to make sure that you don't have any complications. It's very important. Just like your medicine, make sure that you're keeping up with your doctor's appointments. We want to make sure that you have a primary care doctor so that you're able to have someone check labs on a regular basis and check your vitals. And then a neurologist is a stroke specialist. So those physicians can also see you on a not as regular basis, but to make sure that you are on the correct medication to prevent further strokes. And then doctors of rehab, they're called physical medicine and rehab doctors. They are also a part of the team. They are able to see you for such things as your hemiparesis or maybe spasticity. If your stroke has caused one of your arms or your legs to become very, very weak or very, very tight, the physical medicine doctors are very skilled at being able to provide treatments for those ailments and help you to be able to fully participate in your life. And then also help make sure that you're staying in therapy for as long as possible. They say in stroke medicine and stroke rehab that the first 6 months to a year after having a stroke is vital to being able to get as much functioning back after having a stroke. And the way our brain works is that you need to have regular repetitive exercise to be able to regain that function. You're basically rewiring your brain so that it is bypassing the damaged areas and making new pathways. And sitting on the couch does not make that happen. You need to be exercising and moving and seeing your doctors and being in boot camp to really get as much recovery as possible after having a stroke. And that's the realm of rehab medicine. So if you don't have a rehab physician on your medical team, please talk to the stroke support group folks and we can get you connected. Absolutely. All right. So here's some community resources I put together for folks that is always a good idea to have some numbers on hand. And the one-stop shop we really recommend is 211. And this is a community resource line that is sponsored by United Way. And the nice thing about 211 is that they are getting the most up-to-date information about the programs that are out there and the services they have available. For example, if your county might have some funding for rental assistance or emergency housing assistance, 211 is going to know which program has funding and didn't run out of money, and also what the process is to apply, maybe give you some resources on or some advice on the best way to do it. So you're not reinventing the wheel and you speak to a live person. It's not a recording. So they really are there to help you problem solve your specific issue and how to help. We are hearing that some of the social service programs are being stretched. due to the current pandemic, but that doesn't mean don't ask. It just means that be prepared to put the work in to try to find if there is a program that can help you with emergency assistance. If you feel that after having your stroke, you're not able to work again, you can call Social Security Disability to apply for federal disability. There is also the website ssa.gov, and or you could Google, how do I apply for disability in my area? And that will start the process of the Social Security disability application. It's a federal program, and they have a few different ways you can apply. Online is the easiest, but you can call and make an appointment to go down to the office as well. And then if you have become disabled and possibly need additional insurance like Medicaid or food stamps, you can sign up for those programs at myflorida.com/accessflorida. The Medicaid program in Florida, they really don't answer the phone too much, is from my experience. So going online and applying online is really the best way to move forward. If you don't have disability, but you possibly have a dependent child in your home, then you may also qualify for Medicaid in that respect. Unfortunately, if you're an adult and you don't have dependent children and you don't have disability, you can't really get Medicaid. But there are programs in town for folks who don't have insurance. There are some clinics that have sliding fee scales that are funded by the county, and 211 has that information if you need it. But please make sure that you're trying to stay within the care of a physician after having a stroke so that we can be sure that you don't have any further strokes. It's very important, and that you get your medicine. Okay, so adult daycare. This is a program that a lot of folks take advantage of if maybe their loved one is working. Maybe your spouse is still in the workforce and you would be at home by yourself during the day, and we're just not feeling like that might be a safe option at this time. There are some agencies that provide what's called adult daycare, and it's basically just what it's called. You are able to drop off your loved one in the morning, and they have activities and supervision. Depending on the program, they may be able to assist your loved one with toileting and meals. And I was doing some research for this this presentation, and caring.com seemed to have a good list of programs available in each county. But like always, please call and double check and see who's taking new residents. With the pandemic, things are, again, always changing, but that doesn't mean don't ask, because there could be a perfect match for your need and a perfect price point as well. Adult daycare is not covered by insurance, but it is an out-of-pocket expense, but there might be a good match for you based on your income and what your needs are. Okay, so another issue that a lot of folks with stroke have to cope with is called aphasia. And aphasia is the difficulty or inability to speak, or it's either understanding language or expressing language. And so we have some wonderful therapists that are partners with our program. They they're former therapists of ours that have had a personal mission to assist those with aphasia in supported conversation. So please take these numbers down if you are coping with aphasia and would like some resources or some support, and maybe just be around other people going through with what you're going through. Jenny is available, and also Nancy. And then Brooks Rehab up in Jacksonville, we have an aphasia center. That program is good for folks that are usually about 6 months out of their stroke. And it is a very in-depth program. I do not believe it's covered by insurance, but as a nonprofit, I do believe they do have a sliding scale, like most of the programs available through Brooks Rehab. They have sliding fee scales available for those that qualify financially. And then over in Orlando, UCF also has an aphasia house program. It is an out-of-pocket expense, but if you are down in the Orlando area, that might be a good match for your needs. But aphasia can be really a difficult malady to cope with after having a stroke. Please reach out to a speech therapist if you have not had treatment for your aphasia, because there are lots of resources and tools available with iPads and technology to try to support those who have difficulty communicating so that they can be more independent and have their needs met and let people know what they're thinking, which is very important. Okay. All right, so that is my presentation. At this point, I will go ahead and open this up to questions.
I'm unmuting everyone, so please, one person at a time.
I don't know that location, but yeah, those kind of places would be, and honestly, that's where I'd rather be anyway, than in the heat and trying to get people excited.
Does anybody have any questions for Kelly? That was a wonderful resource for everyone. Does anybody want to get involved in having a conversation or ask Kelly about anything specifically that we had gone over? Is anybody still there?
I'm still here, Samantha.
Wonderful.
I'm still here.
Awesome. All that information was wonderful, I have to say. It was very helpful to hear. A lot of pieces of information that sometimes gets lost in translation with discharge, or if you weren't fully involved in like the post-care component, but you actually were very involved in just rehabbing yourself while you're in the hospital. Sometimes it's hard to digest a lot of that information that you just shared with us now. So hearing that information, I think, is extremely, extremely important for everyone to be able to evaluate the again. I think that's great. Does anybody have any specific questions for Kelly? Okay. I think somebody chatted out that you did a great job. That was Cassidy.
Oh, thank you. And my phone number is available on the PowerPoint, and Samantha, I can send that to you if that's something that you want to have on the website so that they could take advantage of the resources and the phone numbers and the email addresses.
That would be wonderful, because I think what I will do is I'll end up, I taped it like I said, and then I will be sending it out there so everyone has access to it so they can review it at their leisure and stop at points to get numbers off of the slide presentation, because I think a lot of the information is super helpful.
Great.
Well, if anybody doesn't have any other questions, I know that we had a couple of patients, past patients and past stroke survivors, or current stroke survivors, I should say, who are on the call. And sometimes everybody's a little shy, so I can understand.
I totally understand.
So you're more than welcome to email us. Touch point with us again if you have any further questions. I can definitely have Kelly contact you directly if you have a question regarding anything she discussed today, or you can call. You can contact me back at the Stroke Support Group at halifax.org, and I'll be more than happy to reach out and see if we can answer any of your questions.
That was very informative.
Yeah.
Did you
Thank
have
you
a
very much.
question? Okay, so if nobody had any particular questions, we'll be doing another presentation next month, but thank you so much, Kelly, for your help.
You're very
and
welcome.
Setting this up, and you put a lot of work into this. You do this every day, and we're so happy to have you as part of our entire support group team. So thank you.
Anytime. We're always happy to help.
Thank you so much, Kelly. I'm going to let everybody else go. It doesn't seem like anybody has anything that they're a little shy.
That's okay.
They don't have a lot of questions.
No worries.
And that's okay. All right, awesome. You have a lovely afternoon, and I'll be posting this, and I'll send you an email with the link so you have it. You can share it with your friends. Okay?
Thank you. Thank you very much.
Thank you.
Bye.
Bye.
Good job.
Great.